So, discharge teaching for Noah Sawyer. I am assuming that Noah Sawyer has meningitis. So he'll actually have a pretty lengthy stay in the hospital depending on what type of meningitis he has. I would assume it would be bacterial just from the signs and symptoms that he's exhibiting. Once he is healthy enough to go home, we're going to give mom a long list of discharge instructions. So I would inform her that if Noah becomes extremely difficult to wake up or it starts to have a seizure, instead of shaking or staring off into space, that they should call 911 immediately. If he develops a red rash anywhere, or if he is kind of exhibiting signs and symptoms that he's having trouble seeing or hearing, he's like not having the startle response, or he has a really weird like loud cry that you're not used to, I would definitely call the doctor. I would also call the doctor if Noah starts having a fever, anything greater than 100.4, if he becomes super fussy, if he's sleeping more than usual, anything like that, just so that way we can get an eye on it pretty quickly. I would also inform her that Noah might be discharged back home with some antibiotics depending on what type of meningitis he has. So just making sure that we complete the full course of antibiotics, otherwise it might come back at some point. Also to keep an eye on thrush, which is like a yeast infection, so looking in his mouth to make sure that there's not like little white patches or anything like that, because that's a common side effect of taking some antibiotics. If Noah is on steroids, to be sure that we are taking them the same time every morning and that we're slowly tapering off of them. That way it'll give some time to build that back up and so he can keep doing it. He's over 7 months old, so he can take the NSAIDs, but I would recommend taking the acetaminophen if he's having a fever. Like I said, anything greater than 100.4 to call the doctor though, because we want to make sure. And then because he did have that lumbar puncture, just keep an eye on that spot on his back just to make sure he doesn't have an infection, anything like that. If it gets red, it's going to be normal to have a little bit of like a mark from it just from irritation. But if it gets red, inflamed, weird discharge colors, white pussy that has an odor, anything like that, to also call the doctor because it might be a little bit infected. Basically, make sure that Noah's getting a lot of fluids. So if you're still breastfeeding, breastfeed as often as you normally would. Make sure that he's getting the adequate food that he needs. Otherwise, I would call the doctor as well to see if he needs some adequate nutrition. If he's not breastfeeding, making sure that you're just putting enough water with the formula, so that way he is getting the correct amount of fluids. But if you have any questions, you are more than welcome to call the office or to call the doctor. Send us an email. We would be happy to get back with you. All right, thank you very much.